this is Mark Austin. I had some interesting things happen in the course of my wife's medical treatment. My wife has been seeing Dr. Nizami now for well over a year. She's had metastatic breast cancer, stage 4, for the last 3 years. And in the course of doing so, often people will ask us what kind of treatment that we're doing to take care of it. And it's kind of funny because everybody seems to have some sort of opinion on it, whether they're versed on the topic or not, whether they're holistic or whether they're integrative or whether they're conventional. So in having these conversations, it's interesting to get the various opinions from people. And I was talking to a neighbor down the street who his neighbors are doctors, conventional doctors, and they work in the ER. And what's interesting is their opinion was, they said, hey, conventional is the only way to go. I don't really believe in anything alternative to that, whether it's holistic, integrative, whatever. Basically, you should just follow the protocol that whatever your oncologist gives you, that's the conventional route. And what was interesting about that was I told him, of course he's going to feel that way, because ER doctors are, in terms of the medical system, when you look globally, ER doctors are probably ranked either in the US #1 to #3 in terms of what kind of care you're going to get. So essentially in the US, if you get banged up in a car accident, you have to go to the ER, you're going to get about the best medical attention that you're going to get anywhere in the world. You're either going to get #1 or within the top 3, but the US is outstanding when it comes to that type of care, or any type of pain type management for something like that. However, when it comes to chronic disease and illness, the US is ranked more like 28th in the world. And it's really not a matter of care per se, it's more a matter of where the dollars are. So you really have to look at what the numbers tell you, and if people really are getting better. In my wife's case, they wanted to put her on chemotherapy immediately, which seems fine to go ahead and do that, but they didn't want to run any tests on her to do so, and they told us the chemos they were going to put her on, everything was modern and they've come so far in all these years. The 2 chemos they wanted to put her on, one was from the late 60s and one was from the early 70s, and as far as I could tell from my research, the formulation hadn't changed at all. They just had about 12 different drugs to try to counter side effect symptoms, not to actually make the drugs more effective, just to try to make it so you really didn't notice what they were doing to you as much. So that was our experience. I believe that the only way to maximize the kind of results you're going to get is really to test everything. If you test what you're going to have first, the likelihood is you're going to have a better outcome. And in doing so, most people would say that we were really nuts in kind of our methodology. And I would say to them that doing the same thing over and over again, doing the conventional means, not testing, does not need to be conventional per se. Anything you're doing, any type of treatment, whether it's integrative, holistic, conventional, and expecting different results than anybody else is getting is kind of ridiculous. To assume that that's kind of the definition of insanity, doing the same thing over and over again and expecting different results. So I think regardless of what treatment everyone chooses to have out there, it comes down to personal responsibility. You have to take responsibility for yourself, your life, your treatment, and know that A, you have options, B, you can research those options, and C, you can go with something that's a little bit more tested. You don't have to arbitrarily try anything. The choice is yours.